This embryology highlights screencast deals with the respiratory system and development of the larynx, trachea, and lungs. The respiratory system includes the nasal cavity and pharynx, but we will not be discussing those. We will focus on the larynx, trachea, and lungs that develop from endoderm from the floor of the pharynx. The first evidence of the respiratory system is a laryngotracheal groove that develops as an outgrowth of the floor of the pharynx. This is shown in black here. This pharynx is cut through, so you can see that this is a hollow groove that communicates with the lumen of the pharynx. More caudally, a septum comes in to separate the groove from the pharynx, and that creates a laryngotracheal caudally. Rostrally, the communication between the pharynx and this groove is maintained, and that is where the larynx develops. This image shows that the initial formation of the respiratory system. The digestive system is in red, respiratory system is green. We have lateral views on top, ventral views below, earliest stage on the left, later stage on the right. Here we see a groove that communicates with the pharynx, but a septum has separated it from the pharynx caudally. However, rostrally, the groove and the pharynx communicate with one another. This will be the location of the laryngeal opening. From a ventral view, you can see that this laryngotracheal tube, as it grows caudally, becomes bilobed, and these lung buds then will give rise to principal bronchi and to the right and left lungs. The wall of the larynx is formed by cartilages. Here, the opening is the laryngeal opening, and it's walled off by cartilages. This is a cricoid cartilage. These are thyroid cartilages bilaterally. There are arytenoid cartilages that move a vocal fold that's not visible, and this is an epiglottic cartilage that is located cranially. Here we are looking at the floor of an embryonic pharynx. We see pharyngeal arches, and the combined fourth and sixth pharyngeal arches are the ones that contribute the cartilage and the skeletal muscle. So here on the floor we see the opening of the laryngotracheal groove, and that will be the future laryngeal opening. The cartilages are formed by bilateral laryngeal swellings and by a cranial or rostral epiglottal swelling. The skeletal muscles are formed by myotomes that migrate from the fourth and sixth pharyngeal arches, and they of course are innervated by the vagus nerve. This shows a nicer drawing of this. Here we are looking from the pharynx, we're looking dorsally at the larynx, and we see the epiglottic cartilage. These are arytenoid cartilages. We see evidence of thyroid cartilage and a cricoid cartilage. On the right, we're looking at the floor of an embryonic pharynx, and we see this epiglottal swelling and bilateral laryngeal swellings that surround a laryngotracheal groove opening. Here is a sagittal section of a canine adult. This is the pharynx, this region here. That leads back to the esophagus and ventrally in through the larynx. These are cartilages that are forming the wall of the larynx. This is the epiglottic cartilage, and so we don't see the opening. It's blocked by the cartilages, but that leads into the trachea. The pharynx then is a common respiratory digestive chamber. As the laryngotracheal tube grows caudally into splanchnic mesoderm, it forces its way through splanchnic mesoderm. Actually, initially, it grows as solid cores of cells, and then it has to hollow out for air passageways. But the surrounding mesoderm then is going to produce smooth muscle, the cartilages, and the connective tissue that are associated with the bronchi and the lungs. The endoderm then is going to form the lining of the trachea and the bronchi and the lungs. As the endotracheal tube grows caudally, it bifurcates into lung buds, and these become principal bronchi. Generally, in our domestic mammals, the principal bronchus will divide into 2 lobar bronchi on the left side and 4 lobar bronchi on the right side. However, this is a pig, and in pig and cattle, on the right side, there is a tracheal bronchus that grows out. That's different from what we see in the carnivore. But the point is that these are growing out, and branching and repeatedly forming finer and finer bronchi. Eventually, then the bronchi will form terminal sacs, which will develop into alveoli. And this image shows that branching pattern in more detail. Initially, the laryngotracheal groove has lung buds, just a pair of lung buds, and they progressively grow, branch more and more. They branch into first principal bronchi, then lobar bronchi to each lobe, then various segmental bronchi to various regions, and then finer and finer bronchi until you get to terminal bronchioles, which are attached to terminal sacs, which will develop into alveoli. As the embryo matures and the lungs continue to grow, they grow as solid cores of cells and cause expansion of the pleural cavity. So the pleural cavity has to dissect into the somatic wall to accommodate the growing lungs. Eventually, the bronchial branches hollow out, and the terminal branches become hollow, dilated, sac-like structures, which are called terminal sacs, composed of very thin epithelium. Alveoli are formed by septae that grow into the terminal sacs, greatly increasing the surface area. Most of the cells of the alveoli are quite thin to facilitate gas exchange, type 1 cells, but some type 2 cells produce a surfactant that reduces surface area and facilitates expansion of the alveoli. In utero, breathing movements take place so that the fetus is prepared for breathing at birth. Considerable lung development will persist postnatally as the individual enlarges in size and more lung capacity is needed. Below we see a terminal sac that is divided by septae into alveoli. So this is an alveolus, here's a alveolus, let's say here's another one. Septae come in and divide it into smaller units called alveoli, which greatly increases the surface area. This image shows an earlier and later stage of lung development in transverse sections. You can see that initially the lung and the pleural cavity is quite small. It has to occupy more volume, and it does that by dissecting into the somatic wall, generating more pleural cavity to accommodate additional lung tissue. This textbook drawing of an adult lung shows alveoli from the vascular surface, and you can see they look like little grapes, and they're highly vascularized, and so there's a tremendous surface area. So terminal sacs are partitioned by septae to form these smaller alveoli. And so this concludes our embryology highlights screencast concerning the development of the larynx, trachea, and lungs.